Hello, my name's Lillie. I'm a clinical lead within the health visiting team in East Cleveland, and I'm based at East Cleveland Family Hub in Saltburn with our early help partners. I work within a team of health visitors, school nurses, early years practitioners and senior practitioners. Today, I would like to introduce you to a topic that I and the team are very passionate about. It is known nationally as ICON, and it helps us to understand a little more about why and when babies cry, and what we as parents or professionals can do about it.
Let me share the ICON information with you. I is for infants cry. All babies cry. It is their way of communicating with their carers and the world in general. It is normal for babies to cry, and it will stop at some point. We will talk about that in a little while. C is for comfort techniques, can help. Always consider the obvious things. Is your baby hungry, thirsty, tired, or in need of a nappy change? Then consider other methods that you know help to soothe your baby. For example, rocking them, taking them for a walk in the pram, soothing music, a warm bath. Not every comfort method works for every baby, but you know your own baby best. O is for it's okay to leave your baby in a safe place and walk away for a few minutes if the crying becomes too much for you. N is for never shake a baby. This might sound like an obvious statement, but unfortunately, research has shown that parents may at some point struggle to cope with their baby's crying, and in some extreme cases, the crying has led them to feel like they may actually harm their child. This is an emotional response of both anger and frustration and can result in them shaking the baby, which causes trauma to the brain and can sadly result in death or permanent brain damage. Even the lightest shake can cause damage, so the idea of this session is to inform parents that they can expect their baby to cry. It is very normal and it will stop. Crying seems to peak in the late afternoon and early evening, but of course this can vary from baby to baby. All babies will cry from the ages of 2 weeks to 4 to 5 months. It is a normal part of their development and is their way of communicating with you. Again, this can vary from baby to baby. There are several factors that affect the amount of crying that you might experience. For example, boys are more likely to cry for longer than girls. Babies that are born prematurely are more sensitive to their surroundings and can therefore be more prone to crying. Babies with disabilities are known to cry for longer, and babies with colic or reflux. It is always important to check with your doctor if you feel that your baby is unwell or in pain. Now that we've established why babies might cry, let us take a look at when they are likely to stop. This is what we call the crying curve, and as you will see, it clearly demonstrates that crying is likely to commence at around 2 weeks of age. It peaks at around 2 months and slows down again at around 4 to 5 months. This also demonstrates that some babies can cry for much longer than others. For example, a low crier might only cry for 30 minutes a day at the peak of time of around 2 months, whereas a high crier could be crying for 5 to 6 hours a day. This can be a very testing time for parents, but evidence suggests that if they know why their baby is crying and when it will stop, they are much more able to cope with it. Your health visitor will be able to discuss the ICON message and the crying curve with you and adapt the information to the needs of your individual baby. Please do not hesitate to contact your health visitor for advice or support. And to recap, crying is a normal part of development. Babies are not doing it on purpose, they are just trying to communicate with you. All parents can feel frustrated at times. Develop a crying plan that works for you. Share the ICON information with anyone that cares for your baby. Remember that soothing techniques can work but are different for every baby. Safe sleeping is always paramount. Never ever shake a baby. Ask your health visitor for further information or advice, the details of which are below. You can reach the central team number on 01287 612 388 or visit the ICON website. Thank you for your time today.